Hello, how are you all? Hope you are fine. This is Dr. Zara and we are solving AMC Part 1 recalls from the Gynae section, and this is one of the trickiest question. So let's start to solve this question. A 17-year-old girl is brought to your practice for evaluation because her periods have not started yet. She also complains of abdominal pain every month and about the same time. On examination, she has a fully developed breast and axillary and pubic hair. She does not consent to a vaginal examination. Which one of the following could be the most likely diagnosis? A. Imperforated hymen. B. Absent vagina. C. Mullerian agenesis. D. Turner syndrome. E. Normal variant. So first of all, what is the diagnosis of this case? She is 17-year-old girl and she has not started her menstruation yet. So this is a case of primary amenorrhea. What is the cutoff age to diagnose the case as primary amenorrhea? What is the cutoff age? So yes, cutoff age is 16 years. 16 years. So she has not started her menstruation yet. She is 17-year-old. So we will diagnose this case as primary amenorrhea. Now, there are the list of causes which can cause this primary amenorrhea. Now, moving toward the next statement, it states that she is having a complaint of abdominal pain every month. Every month, abdominal pain every month. So this indicating that she is having a menstrual phase of her cycle every month, but there is something which causing obstruction. That's why she's having a abdominal pain every month. Something which causing a menstrual blood flow to pass through the vagina. That's why she's having abdominal pain every month. Now, now, what next statement pointing towards? On examination, she has fully developed breast and axillary and pubic hair. Now, this is very important statement because this has ruled out all the causes which can cause primary amenorrhea from hypothalamus, pituitary, and ovarian axis. So it is indicating that she has fully developed breast. It is indicating that she has a normal hypothalamus, she has a functioning pituitary, normal function of the pituitary, and as well as she has a normal function of the ovaries. How this statement indicating that these all are normal? So the main role of breast development, the main hormone which play a vital role in the breast development is estrogen. So where this from where this estrogen coming from? Estrogen is mainly secreted by ovaries. So she has a fully developed breast means her ovaries are normally functioning and it's producing estrogen. That's why she's having a fully developed breast. So that's mean ovaries are functioning normally. Now, one important thing, whenever whenever ovaries are functioning normally, that means her pituitary is also normal. That's why ovaries are functioning normally because it's producing the hormone FSH and LH which work on ovaries to produce estrogen. So that's mean if ovaries are functioning normally, that's mean pituitary is working also normally, and it's keep on producing FSH and LH to stimulate the ovaries to produce estrogen. So that's mean pituitary is normal, and if pituitary is working normally, so that's mean hypothalamus is also normal. All the releasing hormone are producing by the hypothalamus, and it stimulate the pituitary, and pituitary hormone stimulate the ovaries. That's how is the mechanism, we calling it hypothalamus pituitary ovarian axis. So now they this statement is showing that ovaries are normally functioning. That's mean her whole hypothalamus pituitary ovarian axis is normal. Hypothalamus pituitary and ovarian axis is completely normal, and this is not the cause of primary amenorrhea. So, next statement, she does not consent to a vaginal examination. Which one of the following could be the most likely diagnosis? A. Imperforated hymen. B. Absent vagina. C. Mullerian agenesis. D. Turner syndrome. E. Normal variant. So first of all, we will rule out this Turner syndrome because we already discussed here that her ovaries are functioning normally. Remember that most likely cause of amenorrhea, most common cause of primary amenorrhea is Turner syndrome. What happening in the Turner syndrome? In the Turner syndrome, there will be a ovarian agenesis. Ovarian agenesis 45XO, and there will be a ovarian agenesis. But here, by mentioning that statement that she has a fully developed breast, they already uh, make it easy for us to exclude the cause of Turner syndrome. Now, what about the normal variant? This is not the normal variant because she is 17-year-old girl and she has not started menstruation yet. We already discussed the cutoff age is 16 years. So this is not the normal variant. We have to investigate this case. Now there is the confusion between imperforated hymen, absent vagina and Mullerian agenesis. This statement that she is having a complaint of abdominal pain every month, abdominal pain every month. This is very important statement to diagnose this case because all others parameters will be normal and same with imperforated hymen, absent vagina and Mullerian agenesis, because in Mullerian agenesis she is also her ovaries will also properly working in a working condition, and the female in this female we will found a normal fully developed breast with a within a in a case of Mullerian agenesis as well as absent vagina. This is actually due to the paramesonephric duct congenitally. There will be a problem which will not fully develop, and it causes a Mullerian agenesis and absent vagina as well. Absent vagina is one of the variant of this Mullerian agenesis, in which ovaries will be function normally, but there will be a vagina sometime absent and sometime uterus as well, rudimentary or not in a properly functioning condition, atrophic uterus or rudimentary uterus or improperly formed uterus. So this is both the same congenitally problem of paramesonephric duct with the Mullerian agenesis and absent vagina. Absent vagina is one of the variant of the Mullerian agenesis. So actually this statement that she is having a complaint of abdominal pain every month, this statement indicating that her uterus is in normal, her menstrual phase is normal, but there is something which causes obstruction. So what it is? Yes, the answer is imperforated hymen. Imperforated hymen which causing the obstruction of the menstrual blood flow to pass through the vagina. That's why she is having abdominal pain every month, and this indicating that her uterus is normal, her ovaries are normal, her pituitaries are normal, her hypothalamus is normal, but there is something which causing obstruction. Sometimes the obstruction may be due to imperforated hymen, and sometimes it is due to transverse vaginal septum in the vagina which causing the obstruction. So these are the two causes which can cause abdominal pain every month with the same scenario. I hope this is now clear to you. Now we will discuss the explanation. This girl has presented with primary amenorrhea as her chief complaint. A girl is expected to have her periods until the age of 16 years. Always remember this is the cutoff age. So this is the case of primary amenorrhea. Now, primary amenorrhea is defined as the absence of periods after the age of 15 to 16 years in the presence of secondary sexual characteristic, or after the age of 13 to 14 year in the absence of such characteristic. So cutoff age for which we diagnose the case at the age of 13 to 14 years is in which in those girl in which no sexual characteristics, no secondary sexual characteristics are present. So we have to investigate at the age of 13 to 14 years. But in our scenario, she is having a normal fully developed breast. That's why 16 years is the cutoff age in our scenario. But in those conditions in which secondary sexual characteristics are also absent, so we have to investigate at the age of 13 to 14 years. The most common cause of primary amenorrhea is gonadal dysgenesis, such as in Turner syndrome, followed by Mullerian agenesis as the second most common cause. So we have ruled out the most common cause because she is having a normal fully developed breast, which is indicating that her ovaries are normally functioning. So this Turner syndrome we rule out, although it is the most common cause, as well as we have also ruled out the Mullerian agenesis because she is having a complaint of abdominal pain every month. So so next line, on physical examination, patient with Mullerian agenesis have a normal height, secondary sexual characteristic, body hair, external genitalia, but vagina is either absent or present as a short blinded ended structure without a cervix at the vaginal apex. Patient with Mullerian agenesis have a normal 46XX karyotype and a normal hormonal profile. Most patients have a rudimentary non-functioning uterus. In other words, cyclical endometrial shedding does not occur in most of the women with Mullerian agenesis. Imperforated hymen can be another cause of primary amenorrhea. In contrast to the most patient with Mullerian agenesis, patient with imperforated hymen will not have a typical fringe of the hymenal tissue. The patient with a low transverse vaginal septum will have a normal hymen with a more proximal obstruction of the vaginal canal. In addition to presenting with the primary amenorrhea, imperforated hymen and transvaginal septums are often associated with complaint of cyclical abdominal pain or pelvic pain. And another important thing with the imperforated hymen, please remember this pelvic mass. You will always find out some pelvic mass or hematocolpus, blood in the vagina. The clinician will be unable to perform a bimanual examination, vaginal examination. So hematocolpus clots in the vagina will be there with imperforated hymen along with the cyclical abdominal pain. And pelvic mass is very important statement which will be mentioned in the scenario that pelvic mass or vaginal clots will be present in case of primary amenorrhea with imperforated hymen or transverse vaginal septum. So this is some important points through which we can rule out the other causes: pelvic mass, abdominal, cyclical abdominal pain. This is the two important point which you will found in with imperforated hymen or transvaginal septum. I hope this question is clear to you now, and you like this video. So thank you very much.